are cataracts?
When we're born, our eye has a lens. That lens is clear at birth and into childhood and into middle age as well, but then it starts to change in color, it becomes more dense and more yellow, and the light has a hard time passing through that lens. That's essentially what a cataract is. It's the lens of our eye that becomes cloudy as we age, and when it becomes too cloudy, light can't pass through it, and we can't see out of it anymore either.
What are the early signs of cataracts?
Early signs of cataracts would include the prescription of your glasses starts to shift. Symptoms that you can expect are a general clouding and blurriness of the vision. Driving at night sometimes gets a bit more challenging with more glare from oncoming headlights. Reading and other activities in dim lighting can become a bit challenging as well. In the early stages of cataracts, you might notice these things, but if they're not really affecting your life and your activities, then your cataracts are still probably too mild to need anything further done about them.
Do I need to stop driving if I have cataracts?
Only if your cataracts really progress to the point where you're no longer legal to drive because your vision has become so poor. In the early and even the medium stages of cataracts, usually patients are still allowed to drive, but if left unchecked and untreated, yes, cataracts can cause vision loss that could compromise your driving.
Are cataracts permanent?
Cataracts are permanent. As we age, these changes continue, and so that cloudiness will increase with time. And as the cloudiness increases, your vision decreases. Surgery is the only treatment available to fix cataracts.
Are cataracts genetic?
Everybody gets cataracts. And so yes, they are genetic, but we all have the genetics that predispose us to cataracts. Some people get them at earlier ages, some people at later ages, but it's essentially inevitable that we will all develop cataracts during our lifetime.
Can I prevent cataracts?
Because cataracts are essentially inevitable for all of us, there's no true prevention for cataracts. Maintaining the health of your eyes, wearing sunglasses for UV protection, these kinds of things might slow the progression of cataracts, but there's no true prevention.
Did I do anything to cause my cataracts?
Generally, no. Again, they're inevitable. Everybody gets cataracts. Certain lifestyle factors like smoking, diabetes, trauma to the eye, and the use of steroid medications can make cataracts progress faster or at an earlier age, but the vast majority of us have not really done anything specific to cause our cataracts.
Do I really need surgery for my cataracts?
You need surgery when you feel that you need surgery. Generally, with cataracts, you will feel some changes to your vision, either that you can't see as well as before, your vision is getting more blurry, you're having more troubles driving at night, or you're having troubles functioning during the day, doing your activities, things that you enjoy, those sorts of things. If you have cataracts but you're not noticing any significant change to your vision or you're not having any troubles with your lifestyle, then there's generally no reason to proceed with cataract surgery, except in rare situations where your cataracts are actually causing damage to your eyes, but those are generally quite rare. For the majority of people, whether or not we proceed with surgery will be driven by how you're feeling in your life.
When is it time to talk to my doctor about surgery?
It's time to talk to your doctor about cataract surgery when the vision changes from your cataracts are starting to impact your daily life. When you feel that your vision has worsened and you're having trouble functioning and doing what you'd like to do, that's when it's time to start thinking about surgery.
Why do I have to wait to book my surgery?
Cataract surgery, like all surgeries, comes with risks. It is a fairly safe surgery, fairly successful, and fairly low risk profile relative to other types of surgeries out there, but there are still risks. And therefore, proceeding with surgery when you're not having any trouble with your vision, no concerns with your vision, if your cataracts are not that severe, then the risks don't outweigh the benefits. If you wait until the cataracts are starting to trouble you and impact your lifestyle or your vision, at that point the benefits outweigh the risks and it would be worth proceeding with surgery at that point.